So today I'm going to go over some core exercises. People are always asking me, what do I do to strengthen my lower back? What do I do to strengthen my core, my abdominal area, so that I don't have so much lower back pain? And that is really, when I'm working on people's lower back issues, I always tell them, especially if they've had a chronic lower back issue, you have got to get your core strong or this is going to come back. I see much better results from people's lower backs after they get their core part of their body strong. By the core, I mean the abdominal area, the muscles in the lower back, the deep muscles in the lower back, and the muscles in the buttock and the hips. There are three main core exercises that a PhD scientist that has done a lot of work with lower backs has developed. He's well renowned. These are really good. And so I always start off with what we call McGill is the doctor's name who developed these, McGill's Big Three. And so I want to show you McGill's Big Three core exercises. Before I do, I want to say this, things I tell patients not to do that have been working out. I don't like any sit-ups at all. I don't like regular sit-ups. I don't like crunches. Those types of sit-ups actually strain the lower back, put a lot of pressure on the discs of the lower back. I don't like leg lifts. And when I say leg lifts, I mean a person is lying on their back. Let me show you what a leg lift is. And even if they put your hands under your lower back like this is how they're taught a lot of times. You put a triangle at your lower back and then you lift your legs, both legs at the same time. Those are terrible. Don't do those. Another thing that I don't like is when people use one of those stands at the gym and they lift their legs up. They're hanging like this and they're lifting both legs up like that. I don't like those either. So let me show you McGill's Big Three core exercises, and then I'm going to show you two extra after that. A couple of these exercises we call planks. If you're familiar with planks, you're going to know what I'm going to show you on those. But the first one that I had never seen before till several years ago when I started looking at some of his exercises is this one right here. This is a modified sit-up. And this is where we bend one knee. And on the opposite side, you stick your arm under the small of your lower back. The reason we put the arm under the small of the lower back is it maintains this arch in the lower back right here. So when you're doing a slight sit-up, and that's what she's going to do, is like a half sit-up, it maintains the arch in the lower back. And so I'm going to have you tuck it a little further. So bent elbow, bent knee on the opposite side, straight leg, straight arm on the opposite side. And then you're just going to lift your shoulder blades off the surface right there and down. So the bottom corner of the shoulder blade comes off the surface. You hold it for about 3 seconds, and then you do maybe 10 in a row. And then you switch out like this. And then you do another one. Too high, right here. 1, 2, 3, and down. Good. All right. So that's the first one. That's a modified sit-up. The second one is of the big three is a side plank. And so you come on your side. Now, a lot of people, if you're fit, you can do these off your ankles. But if you've never done core work before, you need to do them off your knees. And so your knee is the hinge point right here. This part of your body is straight. So you're straight all the way down through here. And then you're up on your elbow. And you raise your hip just a few inches till you're flat like that. Now, she's not quite straight. I'm going to pull her back a little more because you want to be straight. There you go. And so you're bent at the knees, but you're straight at the hips. And you hold this. If you can get to where you can hold this for like 30 seconds at a time, that's great. If you do it where you hold it for like a 10 count and do 10 in a row, that's also fine, and down. And so then you would do that with the other side. So that's a side plank. And then the third exercise that he teaches is to go on all fours, hands and knees, create a little arch in the low back, stay level at the shoulders, level at the hips. And the way you can start out is just with your arm. Just with your arm. And if that's easy for you, don't get twisted. If that's easy for you, then you can try just your leg. Let's do the leg only. And don't twist your hips, so drop this a little bit. Perfect. And then if you get good at that, drop this down. You can do opposite arm, opposite leg. And drop this down and be flat. This is harder than it looks. And down. That'll strengthen the deep muscles of the lower back. Okay. You can relax, sit on the edge of the table for me. The other two exercises, one I'm going to show you looks like this. I like this exercise. Now you have to hold this exercise for 5 seconds for it to be effective. You put your arms behind your back, you arch back, keep your neck straight where you're not leaning your neck back, and you hold this for a 5 count. Or what I like to do is hold it for 30 seconds at a time, but if nothing else, you have to at least hold it for 5 seconds and then relax and then back up, and you're bringing your elbows together, so you're also working your lower back and the muscles between your shoulders and down. And then the last one is a normal front plank. Let's have you lay on your stomach for me. So a regular plank on the elbows, bring the legs together. She can do this, the easier way is to do it off the knees, but you can do it off the toes again. Okay, do a plank for me off the knees. Yep, off the knees. There you go, right like that. And just hold yourself flat like this. And then once again, I'd hold this for at least a 10 count, but if you have to get used to it, you can hold it for up to a minute and do several in a row. All right, that's all I want to show you today. If you have any other questions, come to the clinic and we can give you a consult.